Welcome to the Soul Pit Media Health and Business Report, hosted by Craig Dawson, Vice President, Soul Pit Media.
Hello and welcome to the Soul Pit Media Health and Business Report. Today we have a special podcast. When Soul Pit Media initially launched the podcast, our goal was to help make our community better in any way possible. And I'm real excited about our special guest today. Our special guest is Carin Fraioli. Now, Carin is the Vice President of Recovery Services for Gateway Rehab. Carin, welcome to the show.
Thank you very much for having me, Craig.
Now, Carin, what career path actually led you to your job currently with Gateway Rehab?
So I was an undergraduate study in psychology and immediately rolled into a graduate program for social work. And in the midst of my social work training and having internships, I had to do 2 internships that I spent a lot of time at. And one of them, I knew I wanted to be with substance use disorders. So at the time, my second internship, which is at the end of your master's training, I called Gateway, where I met my mentor, and started my internship at that point. And from that point, I have never left. So I've been at Gateway since I was an intern, and that would have been in 1999.
Carin, growing up, is helping people something that you always wanted to do?
I would say so. I think that, when I was younger, whatever I did as pretend play or had interest when I got older and then started going to school, my idea was that I wanted to work with people that needed assistance. I just wasn't sure how I was going to do that. I think like many young people, you think, oh, maybe I'll be a teacher or maybe a nurse. Actually, when I enrolled in school, I enrolled to be a nurse and quickly changed that after 6 months and decided that I wanted to go a different way. So yes, I think for me, I always wanted to help people. I was pretty social and enjoyed being around people. And I think that makes obviously a huge difference. So I knew I wanted to go in the helping field. It was just making a decision to decide where to go and how to do that. If I'm being honest with you, when I said to you that I wanted to do an internship with substance use disorders, it was mainly because I had a lot of people that I knew in my life that had struggled from substance use. Older folks, family members and whatnot, but it was something that was very interesting to me and, the effect that it causes in a family throughout the family.
Well, Carin, if we are honest with each other, substance abuse is a big problem, especially in the minority community. And this is something that if it's not a member of your own family, it could be a friend, it could be a friend of a friend, it could be someone that you went to school with, or substance abuse is something that touches everybody. One of the reasons why Soul Pit Media feels that this partnership between Soul Pit and Gateway Rehab is so important is because the problem is so prevalent and it touches everybody. And we are looking forward to working with you and Gateway Rehab to make the community a better place for everyone.
That's wonderful. And you're exactly right. There's not anybody that doesn't know somebody that has struggled from addiction. And some of us, unfortunately, or some people in the community know more than that and have their fair share. So, and it is a family disease. People have heard that before, but what that means is that it affects the family so dramatically in regards to that substance user. And oftentimes there's not just one substance user. Sometimes there's more than one. So you're absolutely right. Minorities definitely have a large substance abuse problem in the community, but there's really nobody out there that can say that they don't know somebody or have contact with somebody that doesn't know someone that has a substance use disorder.
Now, Carin, Can you talk to our listeners a little about Gateway Rehab and some of the services that you offer?
Absolutely. So Gateway Rehab is the largest substance use provider, drug and alcohol provider in Western Pennsylvania. Just recently, in July of 2022, we also acquired Greenbrier Treatment Center, which was another treatment center in southwestern Pennsylvania. Its hub was located in Washington. So we are now a much larger group of people. So we have pretty much, and what I'd like to really talk about with Gateway is how many services we have to offer people and how diverse our services are. So we start at the very top with, anybody that would need withdrawal management. Withdrawal management is for anyone that's using substances that require the medical portion to get relief of and make sure that you're safe while you're doing that. So typically anyone that is drinking alcohol in excess or using opioids in excess, opioids being heroin, pain medication, pills, things like that. We keep hearing about fentanyl. Fentanyl is an opioid. And then your benzodiazepines, which are certain medications that are out there, like Xanax is just a popular one that people know what that is. Those need to be monitored very carefully in order to make sure that you're safe when you stop using them. Then the next step down to that is a residential program. So your residential programs come in all shapes and forms. People can stay for 28 days. People can stay for 120 days. So it really depends on the need of the person and what we identify as really being the criteria for why they would need more time with us. We also just recently added a higher level of what we call level of care, which is a co-occurring disordered unit, which simply means that I have a significant substance use disorder, but I also have a significant mental health problem. And so we have a psychiatrist that we've hired that works on that unit 4 days out of the week, and they see our clients and make sure that we're stabilizing them psychiatrically as well with their substance use so that we can get them back into the community. From there, we have what we call halfway houses. Halfway houses, I always like to explain to people, is you're halfway in and halfway out, still considered residential, but you're going to be getting a job while you're with us. You're learning life skills so that you can go out and be a community member. So get a job, know how to, for example, shop, write checks, go to the grocery store, cook dinners, take care of your children. We have 3 of those. 1 is for women and 2 are for men. And then we have right now 11 outpatient locations, and those outpatient locations vary on what we can offer. So one thing that we talk about are medications. That's part of the toolbox for our patients. We do offer medication management in our outpatients. We call that medications for opioid use disorder or medications for alcohol use disorder. Additionally, we offer what's called partial at some of our locations, which means that you stay with us all day long, pretty much. It's like a job, 6 hours a day, but you're involved in therapy, which is group, family, and individual. Then we kind of go down to another level of care, which is intensive outpatient, includes all the same things, group, family, and individual, and that ranges anywhere from 3 to 5 days a week, and that's 3 hours a session. And then we also have individual sessions, and we have group sessions that are 90 minutes. So as you can see, we really offer a lot of services. And within our residential programs, we go above and beyond to offer other things. So for example, if you're in one of our programs that is residential and you stay with us for a long period of time, we have you on a phase system to make sure that we think you're meeting your treatment goals and then you've identified you're meeting them. But we take folks for equine therapy. We use music therapy. We use art therapy. So we're doing a lot. We've really integrated outpatient psychiatric services into our outpatient locations so that when someone comes to us for a substance use disorder, if there's also a mental health concern, we can have them be seen, evaluated, and continue to see that person through our facility. We also do a lot of telehealth. Our telehealth is a big upcoming thing for us that we want to expand even more. But we do a lot of telehealth. So for those people that by history were not able to make it into a brick and mortar facility, we're going to continue to treat them as long as they have the technology for us to interface with them and offer the same services. So then in those cases where we have moms that have to worry, and dads, but moms and dads that have to worry about childcare, we can make that work, right? Because they can stay home and not have to worry about what are they going to do with their child. Or, transportation can be an issue for a lot of folks. So that's another way that we look at that. So telehealth is really something that we were forced to do via COVID, and we won't get rid of because it is such a huge benefit to us. So we really try to make it as easy as possible for anybody that needs services to get services from us.
Well, you know what? That's the one thing that I love about doing these podcasts, because I just learned a lot. You have an array of services and provide a number of things so that we can truly try to get a handle on this scourge in the community, and not only get these people clean, but get them back to being giving, caring, and participating people, which is very important, to be able to get a job, to be able to know how to deal with the stress. And it seems like even with childcare, which could be a major hindrance to someone who is seeking help, I'm truly amazed at all the services that you offer, and I'm so glad that we have a chance to bring this information out to the community, so that if each one takes one step forward and we continue to work together, we can try to get some of these people back to being full participants in life.
Right. And, we have I failed to mention one other service. It's not a treatment service, but it's a service that's very important from my perspective. We have certified recovery specialists. And what that means is we have a department that's called care coordination. And these certified recovery specialists are peers. They are people that are in active recovery. They're certified through the state of Pennsylvania. And what they do is they work with our clients that meet a certain criteria, and they work with them and they walk alongside of them in their recovery. And it is an amazing process to see. They're not a sponsor, totally separate, has nothing to do with 12 steps, AA or NA or anything like that. This is a care coordination. So give you an example of something that, it always tickles me to think about. We had very many years ago, we had a patient that we really wanted to go to outpatient, and they wanted to go, but transportation was a hindrance. But they could easily get on a bus, but they had never ridden a bus in their life. And they were very scared about riding a bus and doing the transfer downtown and getting to one of our outpatient locations. And we had a certified recovery specialist meet this patient at the bus stop, ride the bus, talk about how to do tickets, how to transfer downtown and get safely to the location. And then they did it back again. And it's one of those things that would stop somebody from going to treatment, but because they were able to do it with somebody else, they made it to treatment, right? I think the other things where people do want to support of a 12-step program, but struggle because they're embarrassed, they don't know what to do, they don't know how to enter into a meeting. That's a scary thing. We'll have recovery specialists take those folks or meet them at the location and say, I'll go to a meeting with you. Let's do this together, right? So that to me is an amazing, our care coordination department is so versatile. It's totally a community-based, service that we offer, and it is really, really helps a lot of people gain recovery, which is what they want and their end goal.
We'll be right back with the Soul Pit Media Health and Business Report.
It doesn't matter the time nor the place, the conditions or transitions. Doesn't matter who you are or who you're with. Before, now, and always. Through all phases of life, Duquesne Light Company is here for you.
Port Authority has a new name, Pittsburgh Regional Transit, PRT for short. It's all about doing an even better job of getting people where they want to go every day. It's also about getting people where they want to go in their careers. PRT is looking for some new faces. We're hiring for every position. We offer great pay and benefits and a direct route to a great future. Go to rideprt.org/careers. PRT is an equal opportunity employer.
Looking for a cost-effective way to help increase your company's bottom line? Look no further than Soul Pit Media. With our award-winning print, internet, podcast, and Soul Pit television options, we can help your business get to that next level. For more information, contact Craig Dawson at 412-407-7685. That's 412-407-7685. And let Soul Pit Media take you to that next level.
UPMC is committed to addressing the health disparities that disproportionately impact African Americans in our communities. By driving education, training, and programming, and building relationships with our community partners, we can ensure that all individuals and families have access to the preventive care, screenings, and treatment that can lead to healthier lives. Learn more at upmc.com/health disparities.
Yeah, who's this? Don Stogie, it's me, Nick the Nub. Hey, my boy, what you got for me? Boss, I got the bundle on some bad news about your best customer, Sammy Sticks. What, sleeping with the fishes? Nah, he's still with Wanda, but he's been herfing with the Cigar Fathers. The Godfathers? No, boss, Cigar Fathers, you know. Friendly, knowledgeable staff, live outdoor patio jams, and a wide selection of cigars and cigar accessories. Oh, how do you know so much about this place? Well, boss, because I've been coming back all week. What? Hey, I'm sorry, Don Stogie, but with everything Cigar Fathers is offering, I couldn't refuse.
The future of transit is now, and we are working to improve your ride. Look for bus tracking technologies and other innovations to keep you better informed. Getting around town has never been so easy. PortAuthority.org.
Do you like entertainment that provides diverse programming? Well, there's a new radio station that provides exactly that. Yes, Pittsburgh's diverse sports and entertainment network provides a mixed radio format and is the place for soulful music, sports talk, and lifestyle programming. Check us out at pghdsен.com. You'll be able to find our radio schedule with all of our exciting entertainment programs. Listen now by going to pghdsen.com.
Did you know that STD rates have increased in Allegheny County?
No, I did not.
Yeah, especially for people under 30.
Maybe I should go get tested.
In Allegheny County, symptomatic syphilis cases increased by 97% and gonorrhea cases by 18% in the past year. And having multiple STDs increases your chances of getting HIV.
Oh, wow. Do you know where I can go get tested?
The Public Health Clinic offers free walk-in STD and HIV screening located at 1908 Wiley Avenue, Pittsburgh, PA 15219.
It looks like I know what I'm doing tomorrow, getting tested, and I'll make sure to spread the word.
For more information, call 412-578-8081 or visit AlleghenyCounty.us/HIV.
We're back with the Soul Pit Media, Health, and Business Report. Now, Carin, as we discussed a little bit earlier, someone going into rehab can truly affect their whole family dynamic. How can a family help support someone who may be in rehab to have a successful outcome?
So really the best place for a family to be is to be supportive of what the family member is doing. So if the decision is made that they're willing to go to treatment, and that they're supportive of that. But additionally is if that client and patient is participating in treatment, we really encourage the family to participate. That's a big part of this whole disease. And so any of our programs offer family programming weekly. So what that means is that we are going to offer an education piece. And then if it's residential, there'll be a visitation as well, where we want to meet with the family. We want to meet with the patients. Sometimes we split them up. But we have an end goal that by the end of the evening, we're going to educate you on something, or the end of the day, we're going to educate you on something that we feel is very important related to the family disease of addiction. So, for example, communication is a big one. So, and it will rotate through what we want to work with the families about, but we'll work on, communication. And so everybody's working on that together. The family feels safe because they're with other families, and the patients feel safe because they're with other patients, right? So it's really good, because we have a lot of family members that come in very angry, and we understand why. But my biggest piece is for the family members. One, we want to try to get you to a place where you're more healthy. And we obviously want to get to your person, your special person, to a place that they're more healthy. So if we can have a productive, group with family members and they're supportive of that, we want them to come in. With, like I said, we do have family members that, they've been run through the ringer. They're frustrated. They need to separate themselves from that person. And sometimes they're not ready to do that. We understand that as well. But we also can do individual family sessions with those clients, and certainly can do phone calls if needed as well. So the family being involved and being supportive of that person doing it is, going into treatment is really beneficial. The more support somebody has, generally the better off they'll do, because if it's residential and they come home after that, then they've got somebody in their corner, right? They've got maybe a safe and sober person that they're able to rely on and help make, some decisions. So the more supports we have, I always like to remind people that family can be made up of lots of people, and it doesn't have to be your immediate family. So, it could be a best friend. It could be, someone's sister. It could be your sponsor if you've been in the program before, if you have somebody. So I try to remind people that family goes beyond what our typical, family is. So if you have somebody that's supportive and willing to support you in this journey, let's talk about getting them involved and having them be part of that.
Absolutely. I couldn't agree with you more. Now, Carin, how can someone who may need help, or someone who may know someone who needs help, how can they contact Gateway Rehab?
So there's several different ways to contact us. The first way is, we can talk with you online. There's a chat feature if you go to gatewayrehab.org. That's one way. You can also peruse the website so you can get a feel for Gateway, which I always tell people to do. There's lots of information on our website. I think it's pretty user-friendly. But the other way is a phone call. And if it's somebody that needs to ask questions, that's fine. If it's somebody themselves that want to get into treatment, that's fine too. We'll direct you the way that is best to have you be directed. So the phone number for Gateway is 1-800-472-1177. And that would be the first way to get somebody help or ask some questions.
Okay, now Carin, we always like to end our shows with a positive message to our youth. And my question to you would be, what advice can you give our younger listeners who may want to be the next Carin Fraioli and make a difference in our community like you are doing with Gateway Rehab?
So I think my best advice is, for somebody, if you know that that's what you want to do and you want to help somebody, you've got to get in there and just start working immediately and identify what you like and what you don't like. I think I can say that now. I'm a lot older. At the time, I didn't know what I was going to like and what I didn't like. I think a lot of people go into school and they think, this is exactly what I want to do. And honestly, if I thought what I exactly wanted to do at the beginning of my graduate career, I'm doing the exact opposite. Not that I didn't want to work with substance use folks, but I really thought that I wanted to work with people on a one-on-one basis. And I couldn't imagine not being where I am today. I love what we do. I'm proud of what we do. So my thing is that you've got to explore options and you have to try different things. And I suggest doing that in an internship when somebody is in school and that's required. I say, maybe don't do what you think you want to do the first time around. Maybe do something else. Maybe try something that seems a little not comfortable to identify what you do want to do. And maybe you'll hate it, and that's okay. And then maybe do what that other thing is. There's lots of opportunities in Pittsburgh for internships and places that want help. Gateway is willing and open to take interns all the time. We want people to come and work with us, so we definitely do that. So I would say look at options. Don't always pick what you think you want to do. Maybe, challenge yourself a little bit and identify, was that a good process or not? And did you like it or not? And then start to make decisions from there. I remind everybody that anybody that goes into social work, we do good work. We sometimes aren't paid for the work we do. So you're not going to be a multimillionaire being a social worker, but the joy and the ability to see people make change in their life is, the repayment that you get. And I do, when I talk to young people that come to Gateway that are interviewing and or interns, I say you don't get a lot of accolades in this field, but when you get the 1 or 2 per year that you do get, it makes all of it worth it, right? So I'd say just be adventurous, try different things. Don't go with exactly what you think you want to do when you grow up. Try some different things and figure it out, and maybe you will find a different course. The other thing I'd like to remind young people about is if you work in a facility such as Gateway or another facility such as ours, you are going to learn everything from family dynamics to substance use disorder to mental health to crisis to medical. There's so much you're going to learn, right? So it's a good place to really kind of figure out maybe what you want to do.
Well, Carin, I have a revelation for you that you're not going to get rich being a member of the news media either, and you're going to work some long hours. So, I wanted to throw that out there. But Carin, on a very serious note, I want to thank you so much for taking time out of your busy schedule. Substance abuse is a real problem in our communities, and we look forward to working with Gateway Rehab and trying to make a difference in people's lives and help our community truly be a city of champions for everyone.
Well, I really appreciate you wanting to talk to me, and we're happy to have that connection with you as well, and can't wait for the next thing that we do together.
Absolutely. And plus, at a later date, I'm going to have to try to have you or someone else back, just so that we periodically check in and try to make sure that we can actually make a difference in people's lives. And that gives me a great sense of fulfillment. I started this podcast to honor my sister who actually died from COVID on another level. But, anything that Soul Pit Media can do as a media outlet to make a difference in the community, that's what we are about. So thank you again so much for your time, and look forward to working with you in the future.
Thank you too, Craig. Nice talking with you.
We'll be right back with the Soul Pit Media Health and Business Report.
It doesn't matter the time nor the place, the conditions or transitions. Doesn't matter who you are or who you're with. Before, now, and always. Through all phases of life, Duquesne Light Company is here for you.
Port Authority has a new name, Pittsburgh Regional Transit, PRT for short. It's all about doing an even better job of getting people where they want to go every day. It's also about getting people where they want to go in their careers. PRT is looking for some new faces. We're hiring for every position. We offer great pay and benefits and a direct route to a great future. Go to rideprt.org/careers. PRT is an equal opportunity employer.
Looking for a cost-effective way to help increase your company's bottom line? Look no further than Soul Pit Media. With our award-winning print, internet, podcast, and Soul Pit television options, we can help your business get to that next level. For more information, contact Craig Dawson at 412-407-7685. That's 412-407-7685. And let Soul Pit Media take you to that next level.
UPMC is committed to addressing the health disparities that disproportionately impact African Americans in our communities. By driving education, training, and programming, and building relationships with our community partners, we can ensure that all individuals and families have access to the preventive care, screenings, and treatment that can lead to healthier lives. Learn more at upmc.com/health disparities.
Yeah, who's this? Don Stogie, it's me, Nick the Nub. Nicky, my boy, what you got for me? Boss, I got the bundle on some bad news about your best customer, Sammy Sticks. What, sleeping with the fishes? Nah, he's still with Wanda, but he's been herfing with the Cigar Fathers. The Godfathers? No, boss, Cigar Fathers, you know. Friendly, knowledgeable staff, live outdoor patio jams, and a wide selection of cigars and cigar accessories. Oh, how do you know so much about this place? Well, boss, because I've been coming back all week. What? Hey, I'm sorry, Don Stogie, but with everything Cigar Fathers is offering, I couldn't refuse.
The future of transit is now, and we are working to improve your ride. Look for bus tracking technologies and other innovations to keep you better informed. Getting around town has never been so easy. PortAuthority.org.
Do you like entertainment that provides diverse programming? Well, there's a new radio station that provides exactly that. Yes, Pittsburgh's diverse sports and entertainment network provides a mixed radio format and is the place for soulful music, sports talk, and lifestyle programming. Check us out at pghdsен.com. You'll be able to find our radio schedule with all of our exciting entertainment programs. Listen now by going to pghdsен.com.
Did you know that STD rates have increased in Allegheny County?
No, I did not.
Yeah, especially for people under 30.
Maybe I should go get tested.
In Allegheny County, symptomatic syphilis cases increased by 97% and gonorrhea cases by 18% in the past year. And having multiple STDs increases your chances of getting HIV.
Oh, wow. Do you know where I can go get tested?
The Public Health Clinic offers free walk-in STD and HIV screening located at 1908 Wiley Avenue, Pittsburgh, PA 15219.
It looks like I know what I'm doing tomorrow, getting tested, and I'll make sure to spread the word.
For more information, call 412-578-8081 or visit AlleghenyCounty.us/HIV.
We're back with the Soul Pit Media, Health, and Business Report.
Hi, this is Debbie Norrell, and welcome to the Soul Pit Media Health and Business Report Community Calendar. City Charter High School will hold a new admissions open house and school tour on March 23rd from 10 a.m. until noon. The school is located at 201 Stanwich Street. City High has one of the highest graduation rates in the state with a 94% average overall graduation rate. Every freshman receives a free laptop for learning, which is theirs to keep upon graduation. City High is tuition-free and open to the public. The 61st Need Annual Scholarship Awards Dinner will be held on Friday, May 3rd at the Wyndham Grand Downtown Hotel. For more information, visit needpgh@gmail.com. It's not too early to make your plans for the Cincinnati Music Festival, July 25th, 26th, and 27th. This year's lineup includes KRS-One, Neo, Fantasia, and New Edition. It all takes place at Paycor Stadium. Go to soulpit.com for more information. Pittsburgh Regional Transit's new Ready to Ride mobile ticketing app offers a convenient way to purchase transit passes and access other important information so that you will be ready to ride. Scan the QR code or call 412-442-2000 for more information. Caring Connections for Youth is a community-led initiative that provides access to support and services to any youth up to age 18 living in Allegheny County as a diversion to the juvenile justice and child welfare systems. Respond the Caring Connections way to disorderly conduct, fighting, truancy, minor drug possession, and parent-child conflict. Dial 211 and press 3 for the Caring Connections Youth Hotline. Don't forget to visit thesoulpit.com for the latest in theater, musical entertainment, job opportunities, and health information. That's thesoulpit.com. Thank you for listening to the Soul Pit Media Health and Business Report, brought to you by Pittsburgh Regional Transit. Looking for a great job with benefits? Check out their website, rideprt.org/careers. Thank you for tuning in to the Soul Pit Media Health and Business Report, hosted by Craig Dawson, Vice President, Soul Pit Media. Thank you, Pittsburgh, for your continued support.